Learnwithdhanya, and this is the second part of HCC frequently asked interview question. So if you have not watched my first video like regarding HCC frequently asked interview question part 1, if you have not watched it, I'll be adding an iClick in the top so you can go through it, as well as I'm making a playlist for HCC questions, so you can go through that also, so it will be helpful. And for those who have watched it already, this will be the continuation. So welcome back, and so we'll see what is the next part. Okay, so today we'll be completely dealing with HCC interview part 2 questions. Okay, in this, like, we have ended up with the 3 types of reviews. The continuation of that will be seen in part 2. So without wasting time, we can enter into the video. Hope so everyone is doing good, and nice meeting you all again. So the first question in this part 2 is, what are the names of 3 types of reviews? This thing is already discussed, but again I'm repeating here. The 3 types of reviews are prospective review, concurrent review, and retrospective review. These are the 3 types of reviews. And then they will be asking you, like, what is prospective review? Prospective review means before the treatment is planned, before the patient has entered to the hospital, the complete review will be done. That is called as prospective review. I'll read the definition once here so that you can go through it. Prospective review include the initial review conducted prior to the start of the treatment. That's what I told you. Like, before starting the treatment, they will do the complete review of the patient, and the initial review for different type of body part. This is called as prospective review. Next thing what they will be asking is, what is concurrent review? Concurrent review is like during the treatment process, when the patient is admitted in the hospital, already the treatment is being started and the patient is in the hospital. During this process, what all the reviews done for the patient, that is called as concurrent review. So we can go through the definition. Utilization review conducted during the patient course of treatment. This involves monitoring the medical treatment and progress towards the recovery once the patient is admitted to the hospital, for assuring timely delivery of quality healthcare services and to confirm necessity of continued inpatient care. That is what, like, whatever treatment he is getting, whether it is rightly given or properly given, those things will be done, as well as they will be regularly checking whether he needs the continuation, like whether some more days are needed for the patient to completely recover from the condition. Those complete review is called as concurrent review. Prospective means before starting the treatment, they will do the review, like all the assessments and everything. That is called as prospective review. Concurrent review, after he has admitted in the hospital and once the treatment has started, they will do, like, they will properly check whether the quality care is being given to the patient, whether he needs some more care, whether his day should be extended, like inpatient day should be extended. Everything will be taken into consideration. That is called as concurrent review. And the third one is retrospective review. Retrospective review is utilization review conducted after the service has been rendered. Like, after completing the service, they will go through all the reviews. That is called as retrospective review. Retrospective review is a process of determining coverage after the treatment has been given. So in this, they will be evaluating, like, what all things they will be evaluating is confirming member eligibility and availability of the benefits, analyzing patient care data to support coverage determination, receiving support clinical documentation from the provider with the payment request. Like, after the discharge process and all will be happening, no, those things will be falling under retrospective review. These are the 3 type of reviews and the explanation. And the next one is, how many types of HCC model do we have? We have totally 2 types of HCC model. And what are they? First one is CMS HCC model, and second one is HHS HCC model. So totally we have 2 types of HCC model. That is, first one is CMS HCC model and second one is HHS HCC model. So next, what is the difference between CMS and HCC model? CMS is, first I will tell you about CMS model and then we can see the HCC. HHS. CMS is base year diagnosis determine next year rate. Okay, whereas in HHS they will do the current year diagnosis for current year things only, setting it up for current year. And then second one is developed for patient less than 65 years, but in HHS it is developed for all aged patients. And in CMS the drug cost is not included, and in HHS drug cost is included. These are the three differences, like which at the time of interview, which you can add up as a point. And then what is MEAT? MEAT, MEAT. So MEAT, it stands for monitoring, evaluation, assessing and treatment. MEAT, monitoring, evaluation, assessment and treatment. So in case of monitoring, what they will do, they will find out like what are the signs and symptoms the patient is having, what is the disease progression, what is the disease regression, everything they will be taking into consideration. And for E, it stands for evaluation. Evaluation means a complete test, what has been done to the patient, that test results. What all test has been done, they will be evaluating everything, as well as how the patient is responding to the medication, everything will be checked. That is called as evaluating. And third one is assessing. Assessing, they will be ordering the test, as well as they will review the records, they will do counseling, everything will fall under assessing. And finally the treatment. Treatment is medications, therapies and all the modalities that will be falling under T, treatment. Okay. And next one is, does telephonic encounter constitute HCC counting? No, it is not at all considered. Only face-to-face is accepted. And next one is, does the record need to contain physician signature, credential and date? Yes, definitely. Like when we do this HCC project now, the main thing which you have to see is whether the record is having physician signature, as well as whether the date is given, as well as the credential of the doctor is mentioned there. Tell few example for acceptable provider in NCC, that is MD and DO. These are considered as the acceptable providers. Okay, so these all about the second part 2 interview questions. So you have to go through it. If you have any doubts, you can put it as a comment, and if you have any other questions that you know from your side, you can add up that also in comment. So it will be helpful for others. And thank you for watching my video completely. And if you find it useful, please do share it with your friends and put it a like. And then if you haven't subscribed my channel, please do subscribe. For regular updates, please do click the bell icon. Thank you so much for watching my video. Thank you so much for your valuable time. Take care. Have a great day.